On today's episode of the Pursuit of Health podcast, I had the unique opportunity to sit down with Dr. Theresa Hamlin, who is the Associate Executive Director at the Center for Discovery. I've worked for over 10 years here in their clinic. At the center, which is spread out over a very thoughtfully designed rural campus with over 1,500 dedicated staff, this magical place is a combination of several things: a working farm, a residential program for over 300 adults and children with complex developmental disabilities, including autism. It is a daycare program, it's a clinic, it's a research center, and so much more. It has become a major contributor to the economic revitalization of the community as well. We sat down and explored what Dr. Hamlin and her team have learned over 30 years now, as they've broken the status quo beyond what was ever thought to be possible with autism and people living with such disabilities. As they've done so, they've created an innovative program known as Healthy Six, which covers everything from assessing the person and their needs specifically as individuals to their environment, what they eat, and so much more. She's embodied this in her book from 2016, Autism and the Stress Effect. As we discussed the center, we also realized that there are so many implications for what they have now learned for our U.S. healthcare system at large in areas such as anxiety, stress, and Alzheimer's. As she looked to the future with their new hospital, which they plan to use to take what they have learned and spread way beyond their 2,000-acre campus so they can share their knowledge with us, and their revitalization and expansion of their research program, we realized that the implications are extensive for us all. So, we had a wonderful time, and I ask you to now join us as we sit down at the Center for Discovery with Dr. Theresa Hamlin. So hello, everyone, and welcome back. We have the pleasure today of being in a very special place, a place that I've come to really enjoy being at, coming up once or twice a month for now over a decade, and have the opportunity to talk about this wonderful place with a very important person here who has helped develop this over the years, been a critical part of this. It's Dr. Theresa Hamlin, who is now the Associate Executive Director at the Center for Discovery in Harris, New York. And we are recording here actually on site. I'm looking out at the beautiful campus, the beautiful facility, and only seeing a small part of a almost 2,000-acre facility, which anybody who comes here the first time is blown away and by the sense of this. I remember, Theresa, when we first came up, literally over 10 years ago, the calming sense of being here. There was something cohesive about it. I felt it, and as I worked here, I started to see it, but until I actually looked and read more about it in the book, and Theresa Hamlin's book here, Autism and the Stress Effect, I didn't realize how conscious this was. It made sense after I read it that it was, but it doesn't hit you over the head when you're here that it's like that. This doesn't look artificially created. It's so natural in its sense, but it makes sense that there was so much thought here. And I think it's a very special place that we're going to be spending some time learning about and how it deals with autism in specific, in a very, very special environment to do so. And I know that you have been working on this campus with program development, implementation, an over $100 million budget here, 1,500 plus employees, and really become a part of the community and a leader in this field. So before we start, I just wonder, did you look back, starting in special education and with children and looking back at this journey of your own and the journey here, did you ever see yourself, a decade or two before being in a place as special as this? And can you tell us a little bit about your journey?
Sure, Eric, I'd be glad to. But first, just thank you for having me. I just so appreciate your work here as well, and bringing your expertise, up here to the country.
No, it's been my pleasure. It's been an honor.
That has just been, just so wonderful for not only our children, but our families and our staff who learn from you as well. So just thank you.
It goes both ways.
So yeah, my journey.
Yes, absolutely.
I feel like I've spent my life here. Actually, I've been here at the center for 38 years now.
Right.
And when we started out, we were just a small little clinic up in Liberty, a little school for kids who had really complex needs, though. These were kids who really could not find their way into the public school. The public schools really rejected them because they didn't know what to do with them. They didn't think that they were capable of learning.
Right.
And, our executive director, Patrick Dollard, started 2 years before me in 1980. And I think, I have to say we did envision something different because we knew what children with complex needs didn't exist. I don't think we knew what that was yet.
Right. But something different than what you were experiencing at the time.
Absolutely.
This just wasn't working for you, what you saw.
Yeah. There is no way that a school or even a hospital setting was enough to treat children that have really complex needs. So we knew we needed more. We needed more science. We needed research. And we needed experts like yourself to all come together under one roof and start to figure out what the needs were and how we could help and, how we could change outcomes for people, change lives. And, we started to understand that nature and being in the country and having fresh air and not having toxins mattered. Right. Good food mattered.
Right.
And we worked off of that in the very beginning. Really not understanding everything fully. We certainly have a much better understanding now about the complex needs and comorbidities that you see in this population.
And we'll talk about that a little bit more, but absolutely. So it really, I think in some ways, this is an evolution and a journey that you do with people who are like-minded, but keeping your mind open along the way and saying what's working, what's not working, instead of being stuck. And that's a theme in your book, which I really enjoyed. It was just a natural read, and it really talked about, in some sense, that evolution, or harks back to that idea that if you force a mold, if you hold on to some old adages, there are things that you want to hold on to and some things you want to give up and move forward on. Otherwise, you get stuck in the way. And you talk a little bit about that as part of your journey. And I think the center has really shown that.
Yeah.
So for the audience, now, who we hold different forms of descriptions about what autism is. And I think in center, in all of your experience, I think really lends a credibility to how do we define autism as far as you have learned and your team has learned, for those who are just entering into this field or want to learn more about it or have a child, how would you describe autism?
I will say that a single word such as autism certainly doesn't capture the breadth of what we talk about when we talk about children and adults with autism. So I would define it as a multi-system, multifactorial, highly complex disease that has different levels of severity, and both the body and the brain are affected. And it has so much to do with the individual's biology. It has to do with behavior, lifestyle behavior, and it also has to do with the environment.
Right.
So we have many children diagnosed as having autism here, and yet they're all very, very different in terms of how to treat them, what affects them the most, and how they go about learning and functioning on a day-to-day basis. So one needs to really, and I call it the crossroads of complexity, understand the biology, understand the environment, and understand behavior.
So when somebody says, are there commonalities, for example? No one autistic person is identical, but what creates some of the commonalities that you have found in autism, where they do share certain patterns that you can use, therefore, in your approach? And then where do you say, but don't get so locked up in that too, because you want to have some flexibility to individualize things? But what would be commonality, for example, in autism?
Sure. I mean, there are, in terms of diagnosing autism,
Right.
there are a triad of problems that you look at, and it's diagnosed through observation. We don't
Right.
have any medical tests yet.
Right.
But you're looking at issues with social communication, how the individual socializes, how they communicate. And clearly there are deficits in both of those primary areas of development. And then there's the added feature of how the individual behaves. So many individuals with autism are characterized as having repetitive behaviors or maladaptive behaviors. So in all of our children, we see the social deficits, the communication deficits, and problems with behavior. And so those are the things that are common. You see that across the population. But where we see the differences really is in the biology. So we have children with very severe sleep disorders here. Many children are obese. Children have significant gastrointestinal problems. They have selective eating problems. Many of them have seizures. And so much of those biomedical problems are really either unrecognized, underappreciated, or because of all the other challenges around socialization and communication, they're neglected. And so that's where you see the differences. And I think our program is different because we look for those differences. We know the commonalities and we have tests for those and we can assess individuals, but it's those differences that we need to understand and begin to treat those problems.
So the diagnosis of those problems and having those different comorbidities, for example, that are going to be individualized in each of those people, is something that you talk about in your book as interacting with the autism and the commonalities of autism, causing more stress perhaps in their lives. And that's a lot about what the book's about and understanding how that plays a role. But the autism itself is not one diagnosis. It often is a part of something else many times. So I'll see in the clinics that a patient will carry another diagnosis, a genetic diagnosis, for example, a chromosome abnormality, but there may be a component of autism to that diagnosis as well. And that's what I've seen, what makes it even a myriad of possibilities in terms of combinations. So I think that it's true. Everybody says, well, it's not just one thing. Everybody is different. And autism can be the main feature or it can be a component of other issues.
That's correct.
Okay.
Oftentimes when a parent will come in and we conduct a lot of evaluations here, and their parent will say, my child has autism, and I'll say, okay, so tell me about your child. What does that mean?
Right.
What are the features of your child so I can better understand what you mean when you say autism?
Gotcha. How does the center fit into that? What is unique about the center's approach now after all these years? I see it, I feel it, but never really had the wonderful opportunity to sit down and talk to you about how did this come and what does the center do that you believe is different than perhaps other places do in terms of its approach to autism and where the center is planning to go with these ideas too. Yeah,
the center has a very unique program. There is no doubt about it. We are a center of excellence for New York State, and our primary task is to teach other programs about the treatment of children with autism. And I think it comes from our understanding that this is a very complex disease.
Right.
And it needs a multi-system, a robust approach for treatment. Right. So we have developed a model here that is a preventative medicine model, and it's called the Healthy Six. And it begins with evaluation, so really trying to understand that individual's biology, both from a physical health, a mental health perspective, understand their behaviors. How do they sleep at night? What do they eat during the day? Are they sedentary? Do they get a lot of exercise? So lifestyle behavior. And then the environment. So
with the first part, the first E, is that what I'm seeing when I see the patients coming with that intake? That's the individualization of it for them, where I don't want to treat everybody the same. So I'm going to get to know that person, their environment stuff. And that's the evaluation that you all do and spend a lot of time on the intake of each person. Is that where that comes in?
Absolutely critical,
Okay.
yes. And we've developed our own tools here that we use in order to understand every part of that individual so that we can understand how to treat them.
Right.
What is the best
Very
method of
tailored, and you
treatment.
see that. I even see one of the most special parts I see here is the attendants, the people that come with the kids who they know and love, and they kind of have tailored almost everything to that person. Every single one of the kids now becomes an individual. They have different ways of doing things, and that must have come out of this intake process and understanding that, because you get to know the kid by what tools the child brings with them and the caretaker brings with them that becomes more part of their identity now in many, many ways here.
That's right. And allows them to thrive.
Right, absolutely.
As an individual.
Yeah.
Yeah,
And then the environment, yes.
Yes. So the second E
Right.
is the environment. So it's the physical environment. It's also the social environment and the community environment that surrounds the child. So
Right.
we look at where they're living, what they're exposed to. Are they living in a high rise in Manhattan and they have to go up and down in an elevator and they don't have access to greenery, to being outside? Do they have access to exercise and things like that?
And do they have a routine in that sense too?
Absolutely.
Right.
Yeah. So the environment is critical, and we'll examine all of that and the effects on the individual. And then we'll look at energy regulation, which really has to do with how much are they sleeping at night? How much activity are they getting during the day? And do they have routines? Because routine is very, very important for all of us, but
Correct.
especially for kids
I was
with
thinking
autism.
that we'll talk about that more in a moment, but absolutely.
Yeah, what I'm saying is probably good for every single
Everyone,
one of us
right.
as human beings living on this planet.
But in some ways, would you say that a person with autism is even more sensitive to those issues, has
Yes.
a less ability to tolerate changes in those
Yeah.
schedules in that environment when the changes are made? In order to build that resilience, you have to have some foundation first to build from. If there's no cohesiveness to begin with, then you can't go out and go beyond those bounds because everything is without limits and definition. But once you create that definition in environment and in energy, then you can start to build from there.
That's correct. That's a hallmark feature of
Right.
autism, not being able to tolerate change
Got it.
in the environment. It's been really interesting, not to digress, but with the pandemic, there was a point in time during this pandemic where we had to stop all family visits. And so often our children go home on the weekends or families come to visit. And parents were very concerned that we'd see an increase in behaviors because that routine was disrupted.
Fascinating.
But
Yeah.
our staff did such a brilliant job helping the children understand what was happening that we actually saw significant decreases in behavior because there was just continuity of care now. And the family, was held out for a little bit out of the picture.
Yeah.
And I think parents really appreciated and understood that their children can do okay without them sometimes.
Which is, as a parent,
It's
both of
amazing.
us are parents, and as a parent, you kind of want to get to that point.
Absolutely.
That freedom to know that you probably started in a situation, as many of the stories you relay, where the parent feels, somewhat guilty, but sometimes at the same time, trapped in a way. And now to know that they can be in a place where almost they could be stepped aside. Every parent goes through that at some point.
Absolutely.
Like, they don't need me so much anymore. But in this, to go to that evolution from a situation where it was probably 24/7 dependence, to say, I can step back and it'll be okay.
Yeah.
That's
I think
wonderful.
both the child and the parent grew
Yeah.
in this pandemic.
But that must have made everyone here feel really good that
Absolutely.
we could do that, even though many of us during this pandemic haven't felt as secure as that. But you've taken, an environment and made an environment where people who were very sensitive and what that could have been extremely damaging and disruptive, and on the contrary,
That's right.
it became their security here.
That's right.
That's a wonderful kudos. And then the next thing I know, and again, I've had the pleasure of eating here. I actually have a Pavlovian craving every time I drive up to come up here to the cafeteria because the food is so good, and that's a big part of the eating, and the nutrition is another of the E's.
Yeah, eating and nutrition is probably the most important of our E's,
Right.
although they're all important. But many of the children who come to us have had a lifetime of processed foods or very, very limited diets. And, if you look at them from a physical perspective, from a health perspective, they're really in poor health. Many of them are either obese or significantly underweight.
Right.
So the first thing that we do is try and get them to eat, a whole foods, plant-based, organic diet. And
a lot of it grown here or locally, too.
Almost all of it
which
grown
is
here.
Part of the magic here.
Almost all of it, yeah. So that you have the highest, nutrient-dense foods for these individuals. And within a very short period of time, and we're in the middle of a gut microbiome study here with Texas Children's Hospital as well as Columbia, really looking at the gut microbiome. And our children's gut microbiome compared to several hundred other children with autism throughout the country is significantly healthier than those other children. And in addition to that, when you look at the behaviors, our children here, even though they come to us because they have significant maladaptive behaviors,
right,
their behaviors are so much better than the other children in the study. So the food here not only changes their health, but it also affects how they sleep at night. It affects their behaviors. It affects their functioning. And we have scientific evidence that demonstrates that as well. So, food is medicine.
Well, that's wonderful because we've literally come from similar backgrounds, you and I, through the Columbia route. And I happened to be of the era when Dr. Gershon was at Columbia and talking about the gut and the second brain and how all those neurotransmitters mean something. And first people were going, are you serious? You think there really is something like that? And now we don't doubt that. Even my own wife is a gastroenterologist now, and I'm sure believes very much in that in her own patients, to see that evolution of understanding how food and neurotransmitters and our mood and our brain and everything we do are interconnected, and see that come together here. It's fascinating. Also, as a cardiologist, I've seen, cholesterol levels drop, blood pressure drop, weight drop, overall fitness, heart rates come down, everything, and with no medication, just nutrition changes. Boy, the implications of that are incredible. And then the next E, what I understand, is the emotional.
Emotional regulation.
Yeah, emotional regulation. So tell us a little bit about that.
Yeah, I mean that's a
big one.
A big one
Right.
for us. And we've been studying. We have a psychophysiology lab here that studies stress levels in kids with autism to really understand why they're having behavioral episodes. So they can be significantly aggressive or have really severe self-injurious behaviors, and that's why they're placed here with us. And so we need to understand why that's happening.
Right.
And our approach is very different than what is one of the primary approaches, I think, in treating kids with autism, applied behavioral analysis, which is based on observation.
Correct.
We know with our kids that we needed to go deeper with them. We needed to understand what was happening from a biological perspective as well, and not just rely on an observation. So
essentially what you were seeing on the surface, you wanted to understand what they were feeling or what was happening before you saw that manifestation.
That's right. So I'll give you an example. We have some children who will just drop to the ground and literally just sit there until you pick them up and move them. And if you're a behaviorist and you're observing that, you're making assumptions about why that child has dropped to the ground. And so often it's someone saying they don't want to go to the next event. They don't want to go into the kitchen, or they don't want to go to school. And what we found so often is that the heart rate of these kids is so high, they really can't go on. They're so stressed at that moment because there's a change in their routine that they just can't.
They're really frozen.
They're frozen, really, yeah. And so if you understand that, you're going to treat that very differently than thinking they don't want to do something. So we've developed these beautiful benches here outside of classrooms and in the houses.
Yeah, they're beautiful. I sit on them quite a bit.
The child can just sit.
Right.
You can go over what the next activity is, and then they hop right up and off they go when they love the next activity. But until you understand the stress and the physiology, the autonomic nervous system, and what's happening to these kids, you can't understand autism as far as I'm concerned.
So you're going back to that idea that the environment and the emotional regulation are
That's
tied
right.
to each other
No doubt about it.
intrinsically. I mean, we find those safe zones of our own, and literally I'll go out in the clinic and sit on the bench with the kid if they're concerned about coming or afraid of coming in, and start it there. And you start having a conversation, all of a sudden, you're all walking into the room together without that stress, which ultimately makes the whole encounter better for everyone, and the results and information you're trying to gather much better. Absolutely. And I think you bring up the point, which I'm a big fan of as well, which is things don't just happen, they were happening.
That's right.
If we didn't see it, it doesn't mean that when you saw that just happened just now. No, it did not. And I think what I've noticed about the caretakers here is they've gotten to know, the people well enough that they become the sensors almost. Even though you could probably measure the heart rate stuff, they're so in tune with the kids, they can see it happening before anybody else does.
That's right.
And it's almost magical, like, oh, he's starting to do this, why don't we go here? How do you know that? I can see it. I can feel it. They're in tune now.
They're in tune. There is no doubt about it. Yeah.
It's a wonderful thing. And then to take it to the final E, which is a lot of what I know you're heading to in the future as well in terms of research, but taking the evidence and what you've learned in this journey that we talked about and basically codifying it, creating some form of database so that you can understand what's working, what's not working, and using evidence to continue to build your platform and continue on your journey. Not just do this with anecdotal information, but really do this so that not only does it work well, but that you can stand up and then hold this up to those who come and say, well, how are you doing this? And you can explain it, and how can we then do this? And you can share it.
That's right. Yeah, that is the final E.
Yes.
Is really gathering enough data and enough evidence that we can change the world for these kids. And that's our mission, is to have other people have the same level of understanding, the depth of understanding that we have here, so that kids are treated fairly, that there's an appreciation for who they are as an individual, appreciation for their differences in biology and their differences in mental health, and that treatment programs understand that individuals understand that, and these kids really can be helped and their lives transformed.
And transforming all the lives of everyone around them, including mine, I will say, just because I've learned so much about dealing with people and children by being up here. And I think as pediatricians, we kind of love this stuff. Because it taps into that inner core, that empathy core of ours, trying to understand that.
Sure.
And seeing where the center has gone, understanding with where you're trying to head in the future. But with all these lessons learned, we talked about this, we touched on it, the lessons that all of us could learn from these things, what it has to do with stress, anxiety, having a regular environment for ourselves, nutrition. What are the implications of what you've done here, this concept of a medical home, which is often used as a buzzword, but way before it was a buzzword that really had no depth to it or really integrity. You created that here over the years, and I've seen that and felt that. What do you think the implications are for the center and what it's done for our understanding of healthcare in general, as we all tackle this now at a very important time with not just the pandemic, but our wellness, realizing that we have issues of hypertension and obesity and diabetes as a whole, and trying to grab hold of this before the next pandemic or other issue comes in so we can tackle this. What do you think the lessons are from the center that could apply to some of those ideas?
Yeah, I think they're huge.
Yeah.
And I think that really is our goal here. It's our, it's what we need to do for society. I think, hearing the stories of, and actually seeing the data on just how COVID affected individuals who had the comorbidities, and just seeing the number of fatalities, but just in general, we as a population, as people, are not very healthy right now.
Right.
You know that as a cardiologist,
Right.
and we can't continue like this. we're seeing life expectancy starting to drop now for the first time in 30 and 40 years, and it's because people aren't healthy. We're seeing the number of individuals with Alzheimer's is rising and continues to rise. So I think what we have here is a lifestyle preventative medicine model,
Right.
and we know how to help people. And I think that it's our job now to share this model. And I think in the future, I would love to see all of us have technology that helps us understand our own personal health. So we don't have to run to the doctor. So we can understand how our heart is doing and how that food just affected our ability to sleep and how sleep then affects our ability to function the next day. And much more beyond that. But I think
Very much like the diabetic who's learned tight control of their sugar
Yes.
levels, understanding other aspects and bringing technology
that's
into
right.
that fold as something that doesn't disrupt us as
That's
it
right.
can, but
It's
can
just
actually help us.
part of our life.
Yeah.
Yeah. And I think we're smart enough as a society now. And, as you said, we have a patient-centered medical home here. So
Right.
we've now tapped into bioengineers and we've tapped into folks that know health informatics. And we're bringing them all together to say, how do we develop a system of technologies that can really help people? Maybe it's just a sensor patch that somebody wears that's telling them all the time how they're doing. And when they need to see the doctor before it's too late, and
Right.
let people take control of their own health, their own lives. And that's where I think we have to go.
Absolutely. The implications for putting control back in individuals and not just putting it in there in a way that stresses them, but I think what creates stress, and you talk about this in the book as well, the idea that stress is created when we lose control. Where we don't feel like our environment and the things around us are under our power, when others maybe do it, and you don't know where the end
That's
is
right.
and what's coming next, and that whole thing that we're all feeling and understand now. And it's kind of not what you do when, what happens when there's a problem that defines us, but what do you do in response to that problem? And how can we learn from a place like the center, which literally, just if anybody can come up and just walk through, the feeling is that this makes sense. It works. And I think that's probably why you kept building on this, because you feel that as you do it. Well, this is working. Let's try a little more and push a little more and push a little more. And then it gets to the point where you become an authority of your own. You go, well, look at us. We're kind of,
That's
we
right.
actually have learned enough that we can help others
That's right.
understand this, and the implications in this time for us as a nation are, with anxiety and stress and aging and Alzheimer's and other neurologic issues. If you can do it for children, some of the most complex behavior and things that we just want to wrap around our hands around and our arms around these children and make them feel better and just hold them tight and say, you're going to be okay. And you've said, well, we're doing that here. That's what we're doing. Our whole place does that here for them. And that makes us all feel better too. And what can we learn from that? So I understand if you would tell us a little bit about where the next big project here, the hospital and the research center, and we'll finish up with that. If you could tell us a little about where we're going.
Sure. The Children's Hospital is our next biggest project here, and it's hopefully going to open by the end of next year, beginning of 2022. It will be a short-term placement for children with really, really complex conditions, both children with autism, but also children with medical fragility.
Right.
And parents, schools, pediatricians, other
community,
physicians, can recommend if there is a child that's really experiencing difficulty in the home environment, in the school environment, in the community, they can recommend that the child come to this hospital. And in the hospital, we can do a really deep biomedical dive on the child, really try and understand, as I talked about, that those trio of factors before: biology, behavior, and the environment, but really understand what's driving the problems in that child. And then actually implement some treatment so they can stay long enough. They can actually stay up to a 6-month period. We expect that it'll be half of that we can probably figure out what to
Right,
do within
right.
3 months. And then allow the child to go back home and go back into their
Wonderful.
school, but then also provide ongoing treatment. So if there's one thing that has come out of this pandemic that's good, is the use of telehealth now
Yes,
and
yeah,
telemedicine
right.
as a really good way to provide continuity of services. So we'll be using telehealth, but we'll also send our staff into the home environment to assist the parent and into the school district to really teach teachers and clinicians how to help that child. So there's there's no other place in New York State like that. There is one other center, the Kennedy Krieger Center, that does a similar type of valuation, but ours is much more robust in terms of how we look at the child and the things that we will be evaluating here. So we're hoping that it will become a model, not just for New York State, but for the rest of the country
So
and
the
perhaps the
hospital
world.
is your way of reaching out.
It is.
I mean,
It is.
I guess I first understood it as more of a way of having more capacity, but you're saying, no, we want to take this. This is how we take this
That's
out
right.
of this wonderful environment into the homes and other areas. And this is how it grows and replicates.
Build capacity, throughout New York State. And then again, if it can be replicated around the country, around the world, that would be fabulous.
And you see the model for other disease when you see this. You know, we're talking about the home care visits and all those things. And basically, when students or people come up to me and say, I'd like to be in healthcare, but I don't know if I want to be a doctor or could be a doctor. Well, there's so many other ways to do it. And you're saying, yes, this is how healthcare reforms. It goes back out to where they come. So they spend less time in the hospital, not more.
That's correct.
Right. They're back there and strengthen that.
That's the idea.
Yeah. And the research center will kind of integrate with that.
Yeah. Yes, absolutely. Yeah. So we're expecting, we have a core research team here already, and we have several very important studies underway, and we'll just continue to build that and really gain more insights into how to help really individuals who have never been helped before. So that's the goal. Now
it all comes together. It makes a lot of sense. I really appreciate the ability to just sit down and talk about such a wonderful place and how it's evolved and where it's going. If people wanted to reach out and try to get more information in addition to this wonderful book I'm holding here that really summarizes well, what else would you refer them to?
I think if they want to just go to our website, www.thecenterfordiscovery.org, they can find a lot of information. A lot of our research studies are posted on that website. It's constantly changing and updating with anything new that's happening here. They can reach out to our admissions team as well. They're very, very knowledgeable about all of the services here. So many, many different ways. We're, of course, on Facebook and Twitter, and we have a great media team here. So
I was on the website, and I could explore it forever, and I learned a lot just looking at the website. So that's a great resource.
Yeah, sure is. Yeah.
And again, the book is Autism and the Stress Effect, and it's a really good start to entering into this world that I think gets thrown around loosely, this term too loosely, and you guys have given it respect to this and how you're approaching it. It's been wonderful. And as we always do, and we finish up and ask a little bit about your perspectives at large here at the Pursuit of Health. We're doing this because we're trying to understand what lessons we can learn from places like the center. And so how would you see in your experience and in your journey and here at the center, what does the pursuit of health mean to you all and to you specifically in your experience in terms of its implications for the American healthcare system? What does that mean?
Yeah, I think the pursuit of health for me means, and we said it before, taking control, really not being afraid to understand how you function from every perspective and really taking the time to think about yourself, your health, and how to help yourself, what you can do to enrich your life. So, and it's different for everybody, but it has everything to do with not being afraid and taking control. And that's what we have to do as a society at this point.
So giving control and autonomy back to people that you would least expect or others would expect to have control, and you've given it to children and people with autism.
That's right.
And the implications are very important for the rest of us as well.
They sure are.
Well, it's been great to watch your journey, understand your journey from your own mentors, reading your book about some of the things you've learned and how you've said, this makes sense, this doesn't, let's move forward, and how you've done that here, and the exciting things that lay ahead for you all. I hope to be a small fly on the wall and a part of that in some way, and really appreciate this opportunity to discuss this magical place. So thank you very much.
That's great. Thank
All
you
right.
very much.
All right.
I appreciate being here.
I hope you all enjoyed our discussion with Dr. Theresa Hamlin from the Center for Discovery. We dove into the often misunderstood and complex world of autism. We learned how her team at this very special place continues to break the confines of conventional wisdom. The lessons we all can learn from the Center for our own pursuit of health as individuals and the nation at large, I believe, are extremely important. I look forward to having you join us on our next episode. I'm Dr. Eric Fethke, and until then, I wish you success in all your pursuits.